This is Radio Health Journal. I'm Reed Pence. This week, the economic costs and benefits of changing school start times.
High school students, when we wake them at 6 a.m., for them, it's the biological equivalent of waking an adult up at 4 a.m. because their sleep cycles are shifted by about 2 hours.
Public health calculated in dollars when Radio Health Journal returns.
Medicare open enrollment is underway, and millions of older Americans are evaluating their options to ensure their health plan meets their retirement lifestyle. Silver Sneakers, the nation's leading community fitness program designed specifically for older Americans, is helping people stay active and do more of what they love by improving their physical and mental health through fitness, fun, and friends. No matter your goals, from running a marathon for the first time to keeping up with your grandchildren, Silver Sneakers can help you live your best life. In fact, 91% of members say Silver Sneakers has improved their quality of life. Offered as a free benefit through leading Medicare plans, Silver Sneakers members have free access to all the amenities of a basic membership at more than 13,000 fitness and wellness facilities nationwide, as well as specialized group exercise classes led by certified instructors. Medicare open enrollment ends December 7th. Check your Medicare plan to see if you have the Silver Sneakers benefit. Learn more and see if you're eligible at silversneakers.com.
At the average high school in the United States, the first class starts at 8 a.m. Some schools start as early as 7, leaving students stumbling through their mornings, groggy from a lack of sleep. As any parent knows, teenagers stay up late. But it's not just by choice. At puberty, the body's circadian rhythms change, and the sleep hormone melatonin delays its daily release by about 2 hours. That leaves teens wide awake until about 11, with no way to get enough sleep for the day ahead.
High school students, when we wake them at 6 a.m., for them, it's the biological equivalent of waking an adult up at 4 a.m. because their sleep cycles are shifted by about 2 hours.
That's Dr. Wendy Troxel, a senior behavioral and social scientist at the RAND Corporation and an adjunct assistant professor of psychiatry and psychology at the University of Pittsburgh. She says teens' alteration of the sleep-wake cycle is a little like jet lag. Imagine if you live on the West Coast and fly for business to New York.
So you travel, and it's now 10 p.m. local time in that new time zone. But in your sort of natural time zone, it's still 7 p.m. Now, it's 10 p.m., and you know you have to wake up to get to a work meeting the next day at 6 a.m. In that new local time, it's 10 p.m. You're calculating, gosh, I got to get to bed by 10 p.m. But guess what? You can force yourself to bed, just like we can force our teenagers into bed, but it doesn't mean you're going to sleep because biologically, your body's just not ready. And that's what we're asking teenagers to do.
It turns out that they're getting the bulk of their REM sleep, for example, between 5 and 8 in the morning in most of the United States. And these are the hours we're waking them up and sending them to school.
That's Dr. Tara Zaporin-Snyder, Executive Director and co-founder of Start School Later, an organization that seeks to ensure that school start times mesh with kids' biology. She's well aware that in spite of the biology, many people blame kids themselves and their smartphones for getting to bed too late to be awake at school the next day.
It is true that if a kid is up on the phone, they're not going to get enough sleep no matter what time school starts. But if school is starting at 7 in the morning and your bus comes at 5, it really doesn't matter what time you go to bed. Even those teenagers who aren't having any phone conversation or do actually get into bed at 9 p.m. cannot possibly get healthy sleep if they have to wake up at 5 or 6 for school. So, what I like to say is that it is true that delaying school start times is no guarantee that most adolescents are going to get healthy sleep. But not delaying school start times will guarantee that most of them won't.
Troxel says only about 20% of high schools nationwide start classes at 8:30 or later, in spite of decades of research showing how it works.
There are really multiple profound benefits of later start times for adolescents: academic performance, their graduation rates, their ability to show up on time and ready for school, and also their mental and physical health. And there is evidence that not only do later start times improve standardized test scores, but they do so particularly among the lowest performing students. But this is really the culmination of about 30 years of research that clearly shows that later start times have benefits for teens' public health and academic functioning.
The science really is crystal clear. It has been clear for over 20 years, since the mid-1990s. But the politics of the issue are what is holding back change. So we're dealing with something that goes beyond research. It goes beyond being right. And that is very often the case when it comes to translating science into policy or into behavioral changes.
Beginning in the mid-1990s, a few school districts, notably in Minnesota, responded to the research by pushing back high school start times. Snyder says the reaction wasn't what they expected.
Many of them found that when they did that, they got, a barrage of angry parents storming the school board. So word on the street was that you don't touch this subject if you possibly can avoid it. And over the next 10, 20 years, periodically, parents experiencing this or parents who were medically involved would push for change at local levels. But they found that their school board members would often avoid changing the hours. And understandably so, because it's really a political hot potato.
Since then, school districts all over the country have cited a whole variety of reasons not to start middle and high schools at a later hour.
Typically, those challenges range from concerns about the impact on after-school activities, particularly sports, the impact on elementary school students. If the decision is to flip schedules, which is often the case, it's not the only solution, though, by the way. Elementary school parents are often concerned. Impact on before or after care, both for students and their families, but also for teachers and their families. And also the impact on transportation and traffic. These are real issues that affect communities. And I don't want to minimize that at all because, I've seen it in my own community. These are legitimate concerns.
However, the biggest reason schools cite for saying no to starting school later is cost.
Most of these costs come from increased costs related to transportation or busing of students, particularly if school districts shift from a 3-tier bus system to a 2-tier. So 3-tier being typically the way it goes is high school goes first, followed by middle school, and then elementary school going last.
But do those cost objections really hold water? If you consider society at large, Troxell's study shows they don't.
What we did was conduct a study of a nationwide shift in school start times to 8:30 a.m. for U.S. middle and high schools. And we did an economic projections model and found that such a shift could contribute $83 billion to the U.S. economy over the span of a decade.
That big savings number even accounts for costs that schools would have to pay for revamped bus transportation for students and for infrastructure improvements such as lights on playing fields. Troxell says it surprises most people.
Frankly, yes. The first reaction people have is shock, just seeing that number in the billions of dollars, particularly when people are used to thinking about this issue simply from the cost perspective and not even thinking out about how the public health costs also have a dollar value attached to them. And the truth of the matter is, despite that sort of striking number, which I was struck by myself, our models were actually very conservative. We only used factors for which there was robust existing data to base our economic projections on. So we didn't include things that we know are associated with sleep loss as well, such as increased suicide, increased obesity, and other mental and physical health issues that are linked with sleep loss among adolescents. We did not include those potential costs in our economic projections.
The cost benefits come mainly in 2 areas.
The first was the improved academic performance and potential lifetime earnings of students when they're well rested. The second pertains to reduced car crash rates among adolescents. And we know that car crashes are the number one cause of mortality among teenagers, and about 20% of fatal car crashes are attributed to drowsy driving. So not only is this an incalculable loss of human life early, but this premature dying also has a negative impact on the U.S. economy by reducing the future labor supply.
While the economic evidence may bolster the case of those trying to get high schools to start their day later, there already was plenty of evidence in favor. And as Snyder says, the evidence doesn't really matter. School start time seems to be a visceral issue, and Snyder says the pushback has surprising venom. Many parents refuse to believe how early school start hours can hurt their kids.
This isn't just that the kids feel bad. It's destroying them. It's setting them up for a lifetime of obesity and diabetes. It's predisposing them to substance abuse. It's increasing the risk of car accidents. It's reducing their chances of maximizing their academic potential. You say things like that, and the parent isn't going to say, oh, my goodness, I better change. They say, oh, give me a break. Obviously my kid is fine and I'm a good mom.
The prevailing idea seems to be that kids would be just fine if they'd get themselves to bed earlier. Troxel says you hear critics derisively call high school kids who need to sleep in snowflakes.
There is this idea that we're coddling our children. And, I think that this reflects a couple different things. First, it's a general societal lack of awareness of the importance of sleep. And we have this tendency to think of sleep as being for sissies. And we see this in adults, too. We have a population of sleep-deprived adults, and we're facing the consequences there, too. But particularly in adolescents, this idea that we're coddling them, I think, is just a fundamental lack of knowledge that their sleep-wake biology is different. And it's specific to this adolescent period. It's not that we're making them ill-prepared for their future. I mean, I hear very frequently, why should we, let students sleep in? They won't be ready for the real world. But honestly, if you had a 2-year-old, that 2-year-old likely needs to nap in the afternoon. We don't say to the parent of a 2-year-old, don't let Johnny nap or he won't be ready for kindergarten.
Sleep itself is a hugely emotionally laden topic for people. We are very emotionally volatile about the topic in this country in particular, where we associate sleep with weakness and lack of sleep with dedication to your job. You pull an all-nighter, you're dedicated to your studies or your work. If you sleep, you're morally weak, you're physically weak. So that's part of the reaction, because this really does have to do with sleep.
And from a practical level, starting school later means asking a whole town to change its everyday rhythms.
Community life revolves around these hours. And therefore, when you suggest changing school hours in any direction, later, earlier, whatever, the community worries quite understandably that their lives are going to change. I mean, when you think about it, anyone who's raised kids knows that you jump through hoops to make these school schedules work. When you suggest you're going to change them, they get upset. And that's understandable. They worry that whatever arrangement they have is going to fall through. They have a job that works perfectly with their drop-off. They have a daycare arrangement that is suddenly not going to work when school gets out later because it starts later. The kids work after school at 2:30 because they're getting out of school at 2. And if school gets out at 2:30, what happens to that job? They worry about things like that.
However, the majority of schools that have made the switch say they'd do it again. Kids show up more often and are more ready to learn when they do. Their test scores are better and their graduation rates improve. Many of their sports teams even do better. You can find out more about all of our guests on our website, radiohealthjournal.net. I'm Reed Pence.
Radio Health Journal returns with medical notes in just a moment.
Each year, thousands of adults in the United States get sick, are hospitalized, and some even die from diseases that could be prevented by vaccines. People with heart disease or those who've suffered strokes are at high risk for serious problems as a result of these illnesses, like the flu or pneumonia. The Centers for Disease Control and Prevention says if you have heart disease or had a stroke, it's especially important to talk with your doctor about getting your vaccinations up to date. Heart disease makes it harder for you to fight off certain diseases. In fact, some vaccine-preventable diseases like the flu can increase the risk of another heart attack. Vaccines are one of the safest and more effective ways to protect your health, and the influenza and pneumococcal vaccines are especially important to people with heart disease or stroke. So don't wait. Vaccinate. Talk to your doctor to get your vaccinations up to date. For more information, visit cdc.gov/vaccines/heart. That's cdc.gov/vaccines/heart.
Medical notes this week. Researchers are finding more and more effects of the lead contamination in Flint, Michigan's water supply. A study from the University of Kansas analyzed birth records and found that fertility rates dropped by 12% while contamination was going on, and the fetal death rate rose by 58%. Researchers also found a 5% drop in average birth weight of babies born in Flint compared with other Michigan cities, and a decline in overall health of babies at birth. Air pollution is bad for people too. A new study in the Journal of the American Society of Nephrology finds that air pollution increases the risk of chronic kidney disease and even contributes to kidney failure. Researchers say nearly 45,000 new cases of kidney disease and 2,500 new cases of kidney failure are triggered by smog levels that exceed safe standards. However, they say even lower levels of air pollution damage kidneys over time. The study finds that Southern California and large regions in the Midwest and Northeast carry the highest kidney risk. And finally, a 20-year-long study finds that in the years following menopause, most women get considerably happier. The study in the journal Maturitas shows that negative mood and depression decrease significantly as women age past 65. Researchers say it's because women have more me time with fewer full-time work and family responsibilities. And that's Medical Notes this week.
Most people have heard of Medicare Parts A and B and the prescription drug benefits in Part D, but a survey shows surprisingly few beneficiaries know of an important option that could combine them in one Medicare plan, what's known as Medicare Part C. A survey for the Better Medicare Alliance shows that 65% of beneficiaries on original Medicare are unfamiliar with Medicare Advantage plans. Notably, only 29% of them say Medicare Advantage was presented as a clear option while they researched plans. Nancy Kokoza, head of Aetna Medicare, explains.
Medicare beneficiaries want plan options. Medicare Advantage plans are an alternative to original Medicare that cover all of Parts A and B and can include Part D and extra benefits like vision, dental, or a fitness membership. Medicare Advantage can also help control your healthcare costs by limiting out-of-pocket costs.
Learn more at Medicare101.com/learn. That's Medicare101.com/learn.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at RadioHealthJournal.net.